Any thoughts, Kelly or Dr. O, on what you're seeing compared to what you might have expected to see in the data as far as outcomes?
Yeah, a lot of the data surrounding the weight regain, you know, the people that were in the clinical trials are obese and they're chronically obese. And so I think that there is a differentiation between gaining some weight because of a certain event like pregnancy or COVID or whatever happened, and having being obese because of that, a single number one time, and then going on to medication to help yourself. And then chronic obesity, where you have been struggling with your weight since you were 13. I think those are two different things. And so when everyone is saying that you'll gain back the weight when you lose, that is studied in those chronically obese patients that qualified for the study. And so I just think that there's a distinction that comes there. And that's one of the reasons that we started our business in the first place, is we knew that not everyone was going to be on these medications long term. We knew that there was people that were just on it for the 15 pounds. And we wanted to make sure that when they do taper off the medication, they have a chance to stay on us, keep the weight off because of, doing the reverse diet and some of the things that we put into practice. But they're just so frightened about it because the clinical data is showing that they're going to regain the weight. And I don't know that that's been studied because it's not necessarily approved for situations outside of obesity. So I just think that it's interesting to bring that up.
And then just going on in that route a little bit, tell me a little bit about, how those real world experiences influence how you treat patients. How are you setting maybe expectations? What are some of the things that you set up when people come to you to help them understand the difference in their outcomes versus outcomes that they may have read about and things like that? What's your approach?
I can say that, I marched through with him about how long it's going to take so that they have a realistic idea that this is, again, not rapid weight loss. So if someone wants to lose 20 pounds, it's automatically going to be, this may be 4 or 5 months. And the only thing that, and we don't put anybody on a diet. I call our program a no diet diet because I think one of the more powerful things about the GLP-1s is that it's helping people to gain portion control. And that, in and of itself is huge, particularly in the world that we live in, and we're bombarded by ads and food. And in New York City, you walk down the street and every single place is a smell in another restaurant. So I think that there's been an overabundance and over nutrition of a lot of Americans. And so just that as a single rule is one important thing. And then anecdotally, another thing that I didn't necessarily expect is that once my patients understand the portion control, is that they're almost instinctively trying to have a more nutritiously dense meal when they're doing that. They're conscious of that, and it's something that has happened almost even more naturally. I mean, I have a nutritional coach that works with patients for our customized dosing, but she's available for additional hire. And I mean, after she was with me for about 6 months, she said, "Are you telling people about my service?" Because people just weren't doing it; they were kind of doing it on their own. So that was another interesting thing that kind of dropped out that I could observe with my patients.